Hi, everybody. Thanks for joining us. If you don't know me, I'm Peter Llewellyn, and I run the services at medcomsnetworking.com. So you'll find information, resources, services, activities, events, and so on for people who work in and around medical communications, medical education, medical publishing, and associated businesses. And one of the things we've done as a spin-off is we've set up a website at first, medcomsjob.com, where you'll find lots of information specifically for people who are interested in learning more about medcoms and the job opportunities that there are. So what we're doing here is we're just answering some sort of frequently asked questions from the job seekers, and we're gonna have a conversation around a question. This one with Jill and with Jade and with Simon from Helios Global Group. And the question, guys, is a career in medical communications a stable option? And Simon, you volunteered to kick that one off.
Especially at comms, which is almost 20 years ago now. I was in academia. I was looking for a move that was a bit more stable than being in academia. And so when I saw MedComms, one of my questions was, because you don't know about it in academia, how secure is this option? You know, I don't want to be on a tenure track because it doesn't seem to happen. So why go into MedComms? But what I would say is, having been in it 20 years, the answer is absolutely it's a stable option. What I've seen over that time is that the number of companies, let alone the number of employees that are in MedComms, just continues to grow. So I think as an industry, it's definitely thriving. So there's obviously something about it that is in demand. I think those agencies that you see increasingly specializations in those agencies. So there are some that are, you know, more on the medical affairs side, some that are more marketing, some that are more PR. So it looks like it's evolving as well. So I think it's a stable option in that regard. I mean, I don't know about you, Peter, but have you got any other thoughts on that? Because you've been in it probably longer than I have.
So I'm the old.
Sorry, I didn't mean to be rude about it.
That's all right. That's okay. Very fair point. No, I think you know, I think the simple answer is stable is always a word I tend not to use myself, if I was honest, because any little business can go through ups and downs, and the wider business and so on. But MedComms is a business that is thriving. There's no doubt about that. And I mean, you know, I've been involved, as you say, for a long time. But even if you take like the 15 years of MedComms networking, you know, it's thrived. It's become a mature business, and there's a lot of work to be done, and that means there's a lot of opportunity for people to make a career here. And I think, and you know, accepting the fact that individual agencies can go through their ups and downs and all the rest of it, if you come into MedComms, you're learning skills that will set you up for a very good career. Sorry.
And I think, no, it's all right. I think we'll come on to this, but obviously the other thing is, you as an individual, once you pick up those skills, there's always the opportunity, even if your little agency, as you've pointed out, you know, I mean, to be honest, sometimes the smallest agencies are the ones that thrive, and it's the big agencies that struggle at certain stages. But you as an individual have a skill set which is then valuable and transferable. As an industry, as a MedComms industry, so in that sense, it's stable. I think the other thing that for me is we're serving pharmaceutical companies or medical device companies, those kinds of industries where their business model has become, they have a core set of things that they do internally, and then they outsource a lot of the rest of it. And MedComms is one of those things that they've decided absolutely they're going to outsource. And so if that's going to continue to grow, and it does seem to be increasingly important in our society, I mean, look at the last 18 months, for example, then again, you just see that it's not something that's going to decrease, it's going to increase, I think, in demand. And, you know, personally, I just bringing it back to Helios, we've seen incredible growth over the time that we've been in existence. I mean, to your point, I guess I was laughing a bit when you were talking about small companies. 5 years ago, we were a very small company. Today, we're looking at 130, 140 people. And hopefully we're doing it the right way in terms of the way that we're growing. But, you know, it's just, it's surprising, actually, I would say, just how thriving as an industry it is. So I'd definitely say it's stable. But I mean, Jade, I don't know whether or not you wanted to add anything in terms of kind of your perspective on it.
Yeah, so I've worked at a previous MedComms agency before I moved on to Helios. And I think, as Simon said, there are so many MedComms agencies now, and they're all growing. They seem to have multiple offices as well, which can be really good and really exciting. But I guess I just wanted to give the perspective of, you know, having started at one company and then moving to the other, that you you know, the skills that you gain at, you know, at one company, as Simon said, you can use them when moving into another, you know, moving into another job at another company. And I think even though the sort of day-to-day would be different because the therapy area that you work on would differ, well, the chances are, you know, it would differ, which in itself makes the job exciting, because, you know, you've got that opportunity to work on a completely different disease, different, you know, different topics, different projects. But generally, the sort of overarching like projects that you work on, whether it's publications, whether it's, you know, a meeting, you know, there's all sorts of different meetings that you could work on. The sort of overarching processes stay the same, so you can really draw upon that experience that you've got and, you know, apply them to your new therapy areas. That could be within the same company or at a different company. But I guess the point is that you know, the skills and experience you gain at one company, you just continue to build on them throughout your career. Like, they don't just become redundant if you decide to, you know, take a change in direction or, you know, apply for a slightly different role at a different company. You continue to build upon that.
Right.
And you don't have to jump companies, by the way. You can stay with the same company.
Yeah. Of course.
That's what I mean. Within the same company, you know, you might go and work on a different therapy area, but that skill set that you've already gained so far is absolutely applicable to you know, to the new projects that you work on.
Actually, it's a really interesting point, Jake, because the other thing, Peter, you know, you're sort of saying, is it stable? Well, one of the things we do have to accept, we're in this industry where we're supporting pharmaceutical drugs, and some of them, you know, during development, they're successful and they come out and it's a blockbuster. And some of them, you as a medical writer, you might spend 3 or 4 years working on them before they even get to launch. Yeah. And you get so excited, and you're like, this is going to be brilliant for, you know, patients with diabetes or patients with Alzheimer's. And unfortunately, it fails at the final hurdle. Now, in some industries, you might go, that's it. There's no longer a function for me. They're going to lay me off. Absolutely not in MedComms, because to Jade's point, you've got transferable skills. The whole point about a medical writer is it doesn't actually matter in the end, once you're well trained, whether or not you're working in a therapy area that you know all about or a brand new one, because you've got the ability to pick up the new one and apply your experience and use it in a way that helps the next drug. So I think that's another thing to think about. That's why it's stable.
And what I say to people is it's hard to get into. We'll all say the same thing. It's very competitive to get into, but once you're in, the doors open up dramatically, and that might mean you know, moving into different roles or different therapy areas or whatever. But get those skills under your belt, and you're going to go well. What, Jill, just bringing you in on this one. What's your
so I mean, I have to echo what's already been said. It is a growing industry. I've been in MedComms for 10 years now, and I've seen a lot of growth in that time. There's plenty of opportunities. The industry, I mean, as you know, I come at it from a non-scientific background. I've worked in project management, client services for a long time, and the industry will always need those non-scientific project management type support alongside the scientific medical writers, directors, leads, etc. I would say a non-scientific background is not a barrier to career progression. In fact, learning on the job is a massive part of the role, and if you've got that keen interest in the therapy area that you're working on, you'll pick up and learn an awful lot throughout your career to help you develop and progress. There's a lot of training that happens within the industry. Once you're in role and you're working on a specific therapy area, you'll be able to do your own research and your own background to kind of further your own self development and progression, and that really does help you kind of progress your career. And I just think there's no end of opportunities within our industry.
Yeah, and just to come back to the basics, as you said, Simon. Sorry, Simon.
I'd like to go, but no, it's all right. I was going to say that the other thing, just come back to what I said at the start. I think the interesting thing for me is internet. Tell me when I'm back.
Yeah, so you are breaking up.
Am I there yet?
Sorry. Yeah. Are we hearing it?
It's always the IT.
Okay, so look, I'm just sorry, Simon, I'm going to just sort of say, and to wrap this up, I think coming back to basics, the pharma industry, there's loads of there's loads of reasons to see a very positive future, frankly. There's new drugs being developed. There's a huge demand for transparency, for that data to be published, to be handled accurately and appropriately and communicated to the right audience and so on. If you take the last 18 months of the pandemic, that's put a huge spotlight on the importance of medical communications and so on. And our business of MedComms is right in the middle of all of that. And that makes it exciting, and it makes it a very, very healthy future, I think. So I'm going to wrap it there, because we've sort of run out of time. I can say huge thanks to Jill and to Jade and to Simon again. I know that I'm saying for all of you that you're happy to be contacted via LinkedIn if anyone's watching this, so please reach out. I'll say from my point of view, I'm happy to hear from anybody. And if you go to firstmedcomsjob.com, you'll find lots and lots of information and in lots of different sorts of ways, which is helping you get an insight into our business. So hopefully that's helped with that question. So I'd just simply like to say to everybody, thank you very much, and give us a quick wave and I'll stop the recording. Bye-bye.
Bye.